watching Health Issues with Dr. P.E. Ungu.
Hello viewer, you are welcome to Health Issues with Dr. P.E. Ungu. In this particular episode, we are going to be looking at frequently asked questions about the enlarged prostate. So there are quite a number of questions where patients keep asking about the enlarged prostate. So that's why we're taking our time to educate you on this. Now, one of the frequently asked questions is this: am I going to be taking my drugs for the enlarged prostate continuously? The answer is yes. If you are on drugs for the enlarged prostate, the standard drugs internationally recommended for the enlarged prostate, how most of them work is that they relax the prostate so that urine can flow out freely. So the implication is that if you stop taking them, the prostate starts becoming tense and starts blocking the urine flow. So just like a patient that is on antihypertensive medications, if you are on the drugs for the enlarged prostate, the implication is that you ought to take them steadily. They are daily pills and you have to stick to that. So the second frequently asked question is this: will the drugs cure me? The answer is no. The drugs that are usually taken for the enlarged prostate are not necessarily meant to cure you for the enlarged prostate. These drugs are meant to relax the prostate for urine to flow out efficiently. That is what most of these drugs do. A few of them that will in some way reduce the size of the prostate. The standard drugs, alpha reductase inhibitors, they are the ones that can reduce the size of the prostate, and they just reduce it by just about 20% by the time you've taken them steadily for a period of 1 year. After that, they don't play any other role in reduction of the size of the prostate. Remember, I said just about 20%. So that 20% reduction, if you look at it mathematically, it might not go a long way in solving the problem of the enlarged prostate. So we recommend that you take these drugs, and if you're taking them, you have to keep taking them steadily. They don't necessarily cure you of the enlarged prostate. And that is why when you start hearing things like, okay, go and take this one, go and take the other one, and if you take it, the drugs will cure you, the prostate will disappear. No, as urologists, we don't encourage those things because there's no scientific proof behind some of those things. The third frequently asked question about the enlarged prostate, about the treatment for the enlarged prostate regarding drugs is this: will the drugs continue to work? The answer here is yes and no. Like I usually say, when you have an enlarged prostate, one thing with the enlarged prostate is that, let's put it this way, every man has got a prostate, and the prostate is one organ in a man that continues to grow almost throughout life. So when you're taking the drugs for the enlarged prostate, it will work. It will continue to work. But for some patients, at some point, the growth of the prostate, the enlargement of the prostate, now supersedes the effect of the drugs on the patient. And at that point, you discover that you will now need to be on catheter, or you will now need superior treatment. And usually, what do you now need? You need the removal of the prostate. And like I usually say, the good thing is that we can remove the enlarged prostate for you without having to cut your body open, which is safe, which we do usually for as urologists for quite a number of patients, and they are happy with it. The fourth frequently asked question on the enlarged prostate and the treatment of the enlarged prostate is this: doctor, do you recommend herbal medications for the enlarged prostate? You know what? The problem we have with herbal medications is that almost all of them does not have dosage. So you are taking things, you're taking pills, you're taking herbal medications for the enlarged prostate, and there's no dosage to it. Some of them are even in pills, but there's no standardized dosage to them. And in addition to that, some of them have not undergone, a number of these have not undergone clinical trials, and you don't really know their side effects. So that is why, as professionals, we don't encourage the use of these herbal medications. I've seen quite a number of patients that ended up with kidney failure because of the damage that has come from the herbal medications they were taking. I've seen quite a number of patients that ended up with other issues. So that is why we don't recommend herbal medications. You must go by the standard drugs that we give for the enlarged prostate for you to stay safe and stay as long as God has planned you should stay. So this brings us to the end of this particular episode on frequently asked questions on the enlarged prostate. We're not done with it. So we are going to continue with these frequently asked questions in our next episode. You can follow us on this channel or page, as the case may be, either on YouTube or Facebook. Thank you very much for watching this episode. You people usually do without cutting the body open. When it is done, does it bring a permanent solution to the problem? Or is there a chance that the problem will come back again? And the answer is yes, of course. It brings a permanent solution to the problem of the enlarged prostate. Once this procedure is done by very good hands like us, then it brings a permanent solution to the problem.
Thank you for watching this episode of Health Issues with Dr. P.E. Ungu. We trust you have gained valuable insight to help you make informed decisions and live a healthier life. For consultations or further inquiries, please call any of the numbers displayed on your screen. You can also visit us at any of our branches in Abia State at number 32 Atikiwe Road, Umuahia, or in Abuja at number 11 Kolawole Street, Dawaki Extension, Abuja, Nigeria. Stay connected with us on Facebook, YouTube, and Instagram for more health education and updates. You may also visit our website at www.elioshospital.com to learn more about our services. Elios Specialist Hospital, your trusted center for urologic and other minimally invasive surgeries.